This video is going to be all about how hip misalignment and asymmetry contributes to lower back curvatures and scoliosis. How am I dealing with that curvature in my practice? And how I'm utilizing postural restoration to realign the spine. So for that matter, I will showcase few of my patients who have a left pelvic tilt, which is provoking the spine to curve into a certain direction. Also, I will reveal a big success story of my online patient from the US who had a significant lower and upper back curvature, but because of our treatment, we significantly improved her condition and avoid surgery.
Do you feel the difference? This is the most important question.
Oh yeah, I feel much different. I mean, I feel amazing and it's really impacted my life in a positive way. Like I'm more productive in everything I do. I'd say the right hip pain improved maybe around 80%, and the shoulder pain has maybe improved around 90%.
Oh, that
Um,
much. Okay, it sounds very
so
good.
it is quite good.
Lastly, I will reveal her protocol of treatment and show you few exercises that you can do on your own. So let's jump into that beautiful video. So before embarking onto any kind of therapy, the core principle that you have to realize that your pelvis position drives your spine in the same way as the truck does to the trailer. So both of these instances has something in common. There is a leader and there is a follower. So the leader is your pelvis. Pelvis, your hips, are the key components. As we move, as we walk, our spine never truly remains stationary. Naturally, as we are stepping forward, there is always some movement and momentum going on in the spine, including some form of micro curvature, micro rotation that happens all the time. Mainly it happens because we walk and move forward. So let's take a closer look how our spine will react to the walking cycle. As we are stepping forward with the right leg, the spine and few lower vertebrae will rotate 5 degrees towards the left naturally. As we are stepping forward with our left leg, the spine is supposed to rotate 5 degrees approximately towards the right. So that deviation cycle calls gait. Also, when we are shifted and we are standing or supported with the left leg, the spine is supposed to curve towards the right, and when we are going and shifted towards the right foot, the spine will move towards the left. If you are getting stuck with your pelvis to one specific orientation because of the previous injury, because of the poor postural habits, because whatever, your spine will also get trapped and stuck in certain position, which will appear as a small curvature of the spine. Now, let's take a closer look onto my patients who have lower back curvatures, lower back scoliosis because of the improper position of the pelvis. All of these three instances have something in common. Is the left pelvis that overtops the right one, which is causing the spine to be curved in the specific direction. All of these are my online patients with whom I'm currently working through the online coaching. Some of them achieved already significant improvements, and some of them are still work in progress. So let's take a closer look on this first guy. You can clearly see, if you will take a closer look, that the left pelvis is over the topping the right one. It's actually higher than the right one. And the spine is curved and turned at the same time towards the right direction as well. And so, as I previously talked, that your positioning of the pelvis is reflecting the way you are habitually walking. So if there is a walking pattern disruption, is going to reflect onto the pelvis position. So take a closer look. Each time he lands on the left leg, the left pelvis hiking up, which pushes the spine to the right direction, which creates the symptoms and pain that he had there. So right now it's work in progress. He achieved some of the improvements, yet still we have a lot of things to do. Here is the very similar type of case. This is a guy from Los Angeles, California. He also have a left pelvis being hiked up, and his spine is also turned rotated towards the right direction. And he has, because of that, a lot of right erector spinae pain. Well, actually, he don't have it anymore. You know, he completely got rid already from his symptoms. The only thing is left is a little bit like still of ongoing asymmetry, but he had a lot of symptoms previously. A lot of pain. It was painful to sit, to wake up. During the morning, it was stiffness all over the body. It was right erector spine pain, shoulder pain, upper body pain. No pain whatsoever at this point. So pretty much the same type of instance, the same type of case like this guy with some minor differences. And the last person, so this is another person who has a left pelvic tilt, but in his situation, every time he lands on the right leg, his back, his spine is curving towards the left significantly. As he goes to the left foot, his spine is getting almost straight. This is a young guy, by the way, 23 years old, and he had this kind of condition for 1.5 years. So he already fixed most of his pain and conditions. So these are instances of normal reversible spinal curvatures that appears because of the improper positioning or alignment of the pelvis. So in order to fix that, we have to exercise a correct pattern of walking. We cannot do these stretches. We cannot reinforce certain muscles like a classical physical therapy approach, because it's just not going to be successful. And quite frankly, all of these people, all of these patients already went through classical physical therapy without zero luck, without zero success. So if you have similar type of curvature, there is a big chance it can be permanently reverted back. That's why it calls reversible curvature, because it's mainly being provoked during the adolescence because of the previous injury, and there is a very mild degree of the curvature. However, if you will wait long enough, there is a potential that this problem may turn into the structural scoliotic curvature, meaning the scoliosis that can be treated only and solely by the surgery and only can be mitigated by the physical therapy. Nonetheless, today's guest, Melissa, actually has this kind of scoliotic curvature, which is a structural one. And we just use the postural restoration approach through the online coaching to mitigate the pain, and we achieved huge results. So if you have a similar type of condition, I can definitely help you out through the online coaching, but firstly you have to message me, email me. I have to figure it out if you are an eligible patient, and we can start to do that entire therapy. It will last like from 3 to 6 months, but it's all worth it. Additionally, besides that, you can come and visit us in Poland in the office. This is Melissa's x-ray, and her spine is curved towards the left while the right pelvis overtopping the left one, which perfectly coincides with the left AIC conception. Plus, as you can see with the arrow, her spine direction is rotate towards the right. Now her waistline, I had to blur it out because she asked me to, but on my webpage you can see that unblurred. Now her walk tells me a little bit different story as her x-ray, because there is a difference between position and action. When she walks, her left pelvis overtopping the right one, which confirms the idea that her spine is turned to the right. Now, after 6 months, you can see her side transitioning of her hips is way more better, which is the reason why she had much less pain. Besides that, she had a severe anterior pelvic tilt, which excessively arched her lower back, but after the therapy, it improved significantly, which contributes to almost full lower back pain resolution. Again, this is her before picture. Clearly, you can see the right side compression due to the asymmetry and scoliotic curve. This picture again was blurred out because she asked me to, but nonetheless, afterwards, she achieved significant improvement in her waistline symmetry, which can be observed from the picture, which is very important for her, as for women, to see that symmetrical picture and aesthetic of her body.
If we would compare your initial state how you felt before you met me and right now. Do you feel the difference? This is the most important question.
Oh, yeah, I feel much different. I mean, I feel amazing, and it's really impacted my life in a positive way. Like I'm more productive in everything I do.
How much in percentage wise the right hip pain improved?
I'd say the right hip pain improved maybe around 80%, and the shoulder pain has maybe improved around 90%.
Oh, that
Yeah.
much. Okay, it sounds very
So
good.
it is quite good. Yeah, so anyway, my name is Melissa. I am a PhD student at Princeton University, and I have had scoliosis for most of my life. I've known it, I've had it. It didn't really start becoming an issue until the summer before my second year of graduate school. And then I started getting very bad pain in my right shoulder. It was mostly the trapezius, so right here. And of course, because of all that studying, it was creating a lot of shoulder tension. So that was not helping. Also, a pretty bad pelvic tilt, and then a lot of lower back pain. Also, a lot of tension in my upper body as well. And it seemed as if just nothing could make it go away. It was this persistent tension, no matter how much I stretched, no matter how much I used a therapy ball, there was just nothing that I could do. And also, I should mention that a year before I started experiencing this really bad pain, it was still there during my undergraduate years, and I was referred by a medical professional to a physical therapist. Unfortunately, the physical therapist had actually made the pain even worse because it was not a very targeted approach. It was very one size fits all. And for instance, one thing the physical therapist told me regarding my shoulder pain was that the back area was weak. He really tried his best and was a nice person, but gave me zero insight into why it was weak, why there might be some compensation elsewhere and how that related to the rest of my body. He just said it's weak. Do some raises with a little weight, and hopefully it will go away. But it did absolutely nothing. So I'm appreciating what I'm doing now with you, which is much, much more targeted and views the whole body as a system.
Yes, I also could recall that you mentioned previously, just when we started during our summer days, that you had some tension in the hip flexor area, I think, in the right one.
Yeah, so that tension has improved dramatically because of the lateral pelvic tilts that I had from the scoliosis, which has also been greatly improved. There was a lot of hip tension in my right hip. Yeah,
Yes.
this is, and so it's kind of right here, like tension all along here that kind of keeps this from going out as much as it could. And any sort of conventional exercise was not helping me at all. But then, as you had explained to me during one of our calls, you really need to strengthen the hamstring and the back of that side. And so then that creates the necessary tension there. And then that will provide the tension in order for the muscle to be able to relax. Whereas that understanding was extremely helpful because before the only thing I was doing for that tension was I kept doing so many stretching videos to stretch that hip out. And I'm like, why is this not helping? But then when you gave me that very targeted feedback and explained it thoroughly on creating that additional tension on the other side of the muscle to pick up some of the slack, that's really when I started noticing results and when that tension went away.
So overall, you had lower body pain, you have mid back pain, and upper body pain.
Yes,
What else that we haven't covered yet? You had previously regarding your symptoms.
I mean, I would say that that's pretty much what it was. It was the pain, as well as when I was walking around during the day, I would feel very frustrated because I knew that, for instance, my right hip was sticking out when I walked. And what I would try to do in response to that is kind of shove it back in, but then it would create some compensation elsewhere. So it's just
Even
like
more tension.
going, yes, even more tension. It's this very carefully integrated sequence of movements that is designed to really train your neurology to move differently. So I am exceptionally satisfied. What I really appreciated about you is that your feedback is so timely. You are very flexible. Whenever I had an issue, you would be very prompt and very thorough. Of course, as I've said before, just the overall reduction in my pain, the increase in my energy levels for that. And because I can really get that type of targeted feedback that taps into both targeting the right muscles gently as well as rewiring my neurology, I can't really see anywhere else where I would get this type of feedback other than with a skilled instructor in these therapies such as you. So I would highly, highly recommend it to anybody who might be struggling with similar issues that I have.
Here briefly I wanted to reveal her therapy plan so you can get better clarity of how that therapy looked like. And although we've did together like 40 plus movements over the course of almost 6 months, yet I will reveal few techniques and exercises that you can do on your own. Firstly, the first point is to achieve sagittal plane neutrality. As you can clearly see, she's arched. She has significant anterior pelvic tilt, she had actually, which provoked her spine to be overarched. The thing is, the spine that being overarched cannot be manipulated from side to side. You cannot rotate your spine, you cannot create a frontal plane transition when you are overarched. So that should be firstly mitigated and neutralized by a lot of exercises. And the key point of these exercises is to develop a strong mind-muscle connection in your hamstrings in the upright position, enhance your heel sensation on both legs, improve knee flexion, focus on pelvic depression, meaning to move pelvis down from the anterior pelvic tilt to more neutral, optimizing your ribcage position, so both ribs has to come down into the internal rotation, and also implement few habits, postural habits. So once you've done that, we are shifting towards the restoring the proper left stance. As I previously mentioned, doing the proper left stance, the spine, the lower back should arch towards the right, naturally 10 degrees or something like that. But since she lost that proper left stance, since her spine is curved too much towards the left, somehow we have to manipulate the spine to move toward the right. That's why we would have to restore proper left stance, to restore proper ilium bone position. A lot of exercises, it's just not one or two. The third step is to re-establishing the left diaphragm and left internal obliques. Again, it's a part of the left stance. If your spine is curved again towards the left, we would have to utilize the rib cage and your inner abdominal to shift your spine towards the right, so the rib cage movement will help you, will assist you with that goal. So take this rubber band, like shift your body mass 80% on the left heel, bend your left knee, and try to pull that rubber band close to your left thigh. Look at this. Bam. Right now I have pre-activated my left IO internal obliques muscles and transversal abdominal muscles. In this position right now, what I am doing correct from the standpoint of biomechanical perspective, abduction of the thoracic spine and the thoracic on the rib cage to the left side. Look at this. Bam. I'm standing straight as for right now, and in this position I'm trying to breathe. Breathing through your nose, breathe out through your mouth. 1, 2, 3. Pause and inhale, and try to inhale in your right chest wall like this. And again, exhale. 3-second pause, and right now I am actively working with my left hemidiaphragm. And once again, inhale through your nose, exhale through your mouth. The fourth step is to derotate, to start the rotation process of the spine. And again, right leg activity. When you are stepping over to the right leg properly, you're supposed to derotate your sacrum bone and your lower vertebrae towards the left, naturally. So we would have to kind of overemphasize that phase of gait, overtrain it, overcorrect it. So her spine that was previously pointing towards the right will start to point more towards the left. So for that matter, we have to use right stance muscles, right quad, right buttock, right hip flexor, which will derotate the spine again.
The exercise integrates movements of the chest and pelvis while you're seated. In the initial position, your pelvis is oriented to the left, but as you reach forward with your arm, your rib cage rotates toward the right. Initial position. Sit as I do. Bend your knee forward and place a small ball under your right knee. Put a similar dense padding under your left knee. The key point here is to bring your right heel and left knee as close together as possible. Your lower limbs shouldn't be scattered around. This creates a short leverage for activating the consecutive muscles. Firstly, lean onto your right arm, making sure your trunk is not completely straight, but inclined toward the right side. Bend your right elbow and retract your right shoulder blade toward your spine. Pull your left knee toward yourself and press it into the ground. It will create a tension in the left groin or left adductor muscles. Then push your right knee forward and press it into the ball. If you can't move it forward, simply maintain the intention. Feel the activation in your right glute max muscle. Now, inhale while reaching with your left arm forward and exhale while lowering your left ribs down. This action elongates your right side and rotates your torso to the right. By the end of this exercise, you should feel tension in your right triceps, between your right shoulder blade, in your right gluteal muscle, and in the adductor muscles of your left thigh. Hold it for 3-5 breaths.
That's why right leg femur on acetabulum, right leg external rotation exercises are crucial for derotating the spine. The fifth very important point is to derotate the rib cage. Because if the spine wants to be rotated towards the left, we have to derotate the rib cage back towards the right and also improve the airflow inside of the rib cage. Because habitual airflow pattern also points your spine to a certain direction. So by training that, proper breathing, we can derotate the spine and improve the symptoms, especially in the upper body. And the last thing is integration all of the previous parts into the one movement, yes, into the walk, into the standing activities, which is the most difficult part to do because you have to focus on various things at the same time. You have to train your neurology to make it unconscious behavior, finally. So being upright integration activity while maintaining the correct previously learned body positions. Relearn alternating reciprocal movement in newly corrected position to minimize spine torque, especially focusing on the left lower extremity control. Incorporating walking exercises and modification addressing the alignment and movement from feet to head. So basically the most challenging part to accomplish, yet she accomplished that with flying colors. She was very successful with holding on to the discipline, with doing all of the duties, all of the exercises. That's why she gained that significant improvement.